A macule is a flat, non-palpable area of color change on the skin. It has the following key features. A macule is usually less than 5 mm in size. It is typically flat, and the color may be brown, red, or blue. When touched, it is usually smooth and not thickened. An example is early vitiligo. When we say macule, it generally refers to a skin color change or superficial inflammation limited to the epidermis.
A patch is essentially a large macule, flat and non-palpable. It has the following key features. A patch is usually larger than 5 mm, often extending over several centimeters. It remains flat and cannot be felt when touched. The color may be brown, red, blue, or hyperpigmented, similar to macules, and the surface is usually smooth, though some patches may have slight scaling. Examples include large vitiligo patches, café or lace spots, port wine stains, or tinea corporis. Patches indicate larger areas of epidermal pigment change or superficial dermal inflammation. A papule is a small, raised, solid lesion. It has the following key features. A papule is usually less than 5 mm in size and is raised, making it palpable. It is located in the epidermis or upper dermis of the skin, and its color can be red, brown, pink, or skin-colored. The surface may be smooth, rough, or scaly. Examples include pimples, small dermatofibromas, lichen planus, or molluscum contagiosum. Papules indicate localized dermal or epidermal infiltration, inflammation, or hyperplasia. A nodule is a firm, raised lesion, deeper and larger than a papule. It has the following key features. A nodule is usually greater than 5 mm in size, raised, and easily palpable. It extends into the dermis or subcutaneous tissue, and its texture is typically firm, sometimes rubbery. The color may be skin-colored, red, or violaceous. Examples include large acne nodules, lipomas, rheumatoid nodules, or cutaneous tumors. Nodules suggest deeper dermal or subcutaneous pathology, infection, or neoplasia. A vesicle is a small, fluid-filled cavity within or beneath the epidermis of the skin. It has the following key features. A vesicle is usually less than 5 mm in size and is usually raised on the skin and translucent. It contains clear serous fluid and has a thin-walled surface, making it easier to rupture. Examples include chickenpox, herpes simplex, contact dermatitis, or early bullous impetigo. Vesicles indicate intraepidermal or subepidermal fluid accumulation from inflammation or infection. A skin ulcer is a loss of epidermis and dermis, sometimes extending into subcutaneous tissue. It has the following key features. A skin ulcer varies in size, is depressed, and often has irregular edges. The color may be red, yellow, slough, or black, which means dead cells, and the surface shows loss of skin layers, which may bleed or exude fluid. Examples include diabetic foot ulcers, pressure sores, and venous or arterial ulcers. A spider nevus is a central bright red arteriole with radiating capillaries resembling a spider. It has the following key features. A spider nevus has a central arteriole of 1 to 5 mm, with thin radiating capillaries extending several millimeters. The center is slightly raised while the radiating vessels remain flat. Its color is bright red and it is smooth in texture. The central arteriole blanches, that is, when you apply pressure, it disappears, with pressure but refills immediately after release. Spider nevi suggests superficial vascular dilation and may indicate systemic disease. It appears in diseases such as liver disease, pregnancy, or oral contraceptive use. Purpura are red to purple spots, 3 to 10 millimeters caused by bleeding under the skin, non-blanching, does not fade with pressure. It has the following key features. Purpura are usually 3 to 10 millimeters in size, flat or slightly raised, and red-purple in color. The surface is normal and the lesions do not blanch when pressed. Examples include vasculitis, platelet disorders, or infection-related purpura. Purpura suggest vascular leakage or platelet/coagulation abnormalities.
Ecchymosis is a bruise caused by subcutaneous bleeding, usually larger than 1 centimeter. It has the following key features. Ecchymosis are flat or slightly raised, with color changing from purple to green to yellow over time. The surface texture remains normal. Examples include trauma, coagulopathy, or medication-related bruising. Ecchymosis indicates subcutaneous bleeding, possibly due to trauma or bleeding disorders.
Petechia are tiny red or purple spots 3 millimeters caused by capillary bleeding, non-blanching, does not fade with pressure. It has the following key features. Petechia are usually less than 3 millimeters, flat and red or purple in color. The surface remains normal and the lesions do not blanch under pressure. Examples include thrombocytopenia, septicemia, or trauma. Petechia indicate microvascular bleeding, often of systemic origin. Subdermal hemorrhage is bleeding beneath the dermis, causing bluish-purple discoloration. It has the following key features. Subdermal hemorrhages vary in size, are often irregular in shape, and may be slightly raised. The color is usually blue or purple, sometimes changing over time, while the skin surface above remains normal. Examples include trauma, coagulopathy, or hematoma formation. Subdermal hemorrhage suggests deeper dermal or subcutaneous bleeding.